Welcome to Skin Talk. We've got another great episode planned for you today, as usual.
Yes. I love all our shows.
I know.
But then again, I'm biased.
I know, but we have some fur babies on the show today.
I know.
It's really
and we
exciting.
have Dr. Peck with us today
Yes.
from Hampden Veterinarian Clinic, who is just an amazing veterinarian, 22 years experience, so that'll be nice.
Yeah.
And I'm just always so curious as to what Leanne surprises us
I
with
know.
today.
She's always got something good, so let's keep it a surprise.
Yes.
So,
You have to
good
stay
stuff.
tuned to find out.
Yeah.
But in the meantime, it's been on my mind because the warmer weather has been coming up.
I know.
And
it's exciting.
It's crazy because you go into the store at like Christmas and they already have like New Year's,
I know.
stuff out. And
It's
Christmas
always
didn't even happen.
steps ahead.
Yeah, so here it's like Easter and St. Patty's Day and everything's so crazy. But I'm seeing sunblocks. I don't know if it's a pet peeve with some, but it's just my personal thing. SPF 15.
Right.
I don't really feel why.
Yeah, why bother type thing?
Yeah.
Yeah.
And I know we talked about this before too, but the numbers.
Right.
Let's share with our viewers as best as we can, because I know it's a complicated kind of step, what the numbers actually mean.
So from what I've been told, it basically means that it amplifies your burning time, the time it would take you to burn. So if I burn in 10 minutes and then I put on an SPF 15, it would take me 150 minutes to burn. So you multiply it.
Okay.
So most dermatologists, the people that I talk to, 15 is low, but it's not as low as some of these tanning oils that are 5 or 7s or 8s.
Yeah, well, that's the thing. Stay away from the tanning oils.
Right, get away from that. Wear an SPF.
I had a discussion with a friend of mine where they kept on saying, tanning. No, you don't want to tan. It's sunblock.
It's sunblock.
Not tan. They're
not
like
tanning
tan block.
aid.
I'm like, no.
Right, but I've talked to a lot of dermatologists about this because there is a lot of controversy because there's SPF 50, there's SPF 100, there's broad spectrum, there's helioplex, there's all these terms out there. From what I've always been told by any dermatologist that I talk to, 30 SPF. Anything above that, they say, is a marketing ploy. Because what you don't want to happen is when you go over a 30, sometimes people will put on 100 and they'll think, I'm protected for the entire day.
But then they'll do 15 on the flip side of that. And be like, oh, well, I put something on.
I put something on, so I'm all set. The reality is that no matter what SPF you're wearing, you need to reapply it every 2 hours.
Right.
Regardless of whether or not it's sweat-proof,
so what do you
water
feel?
resistant.
Do you feel like the 30 is?
I am constantly putting it on, so a 30 is okay for me because I'm putting it on probably every 20 minutes.
Right.
Yes.
See, for me, I don't know, maybe it's just a mental thing, but I like 50.
Yeah.
And that's a good point that you brought out too, because I don't think a lot of people, some people may know, is if they're laying in the sun, at what time frame do they feel like they're going to burn?
Every 2 hours you got to reapply.
Like maybe you'll burn in 10,
right,
but I'll burn in 20.
Right.
Or some people, they'll be out there for 5 minutes and they're already starting to get color and stuff like that. So it is good to talk about, and it is some, controversial out there. And I think, we want to stay away from personal feelings and just be like, okay, whatever you use, just constantly put it on.
We would actually love to hear what you folks at home use. So write into our Facebook page, tell us what level SPF you use. If you have a favorite brand that you like to use, I think it would be really interesting to hear what other people's opinions.
Or how often, especially the guys out there.
Right.
There are some guys who do use it, but they'll go for the 15 and they'll do it like once and be like, okay, I'm good.
I'm done for the day.
Yeah.
Right.
So that's good to see also how often it's used.
Yeah.
But.
So write in.
Okay.
Keep us informed of what you're doing.
So we'll give the tally.
We'll chat about it.
Yeah.
But in the meantime, stay tuned because we have Leanne's segment coming up and we have Dr. Peck, and you're not going to want to miss it.
Yeah. So we'll be right back. Do you know Skin Talk? Well, you should.
Melanoma rates are increasing faster than all other cancers in the United States.
So you should watch Skin Talk because you'll learn about melanoma early detection and prevention and overall skincare health.
So start watching.
Welcome back.
We are lucky enough to have Dr. Peck and Angela here from Hampden Vet Clinic, and we're going to be talking about pets and melanoma. Yes. We also have Sandy here, it's my girl.
Yes, a very special guest. And we have my little Tallulah and the handsome Bullet. And with us, Dr. Peck and Angela brought their special little Lily.
Yes.
So welcome.
Very sweet.
What I would like to ask is there certain pets or certain animals that are prone to melanoma?
Yeah, both cats and dogs can get melanoma. Horses can get it also. Mostly it's gray horses that get it.
Really?
With dogs, there are certain breeds that are more prone to it, though all breeds can get it. Golden retrievers, dachshunds, terriers, such as a Yorkie, and poodles are more prone to getting melanoma.
Now, is there a reason why that's
is it related to
like
sun
a gray
exposure,
horse and certain breeds? Is it like, because of the Irish?
Is the gray horse the pale skin of the horses?
That's what I'm saying. The Irish and like fair-skinned people are more prone to it. Is that how it works?
With gray horses, it is more associated with the sun damage because, of course, a horse lives outside.
Yeah. Right.
And a gray horse, they're actually born with pink skin, and so they're more sensitive, and they will develop it. In the horse, though, it tends to not be malignant. It tends to mostly be benign.
That's great.
They'll develop lesions over their eyelid, on their muzzle, under their tail, in the vulva area of females. And they'll sometimes develop it along the jugular furrow of their neck. Now, these do not, if it's not bothering the horse, if tack doesn't interfere with it, they don't need to be removed. They just leave them alone. Once in a while, you'll get a horse that will develop malignant melanoma. And in those cases, you can actually use high doses of Tagamet, cimetidine. And it has proven to be effective in shrinking the tumors.
Now, is that the same treatment that you would do for a cat or a dog that is diagnosed with a melanoma?
No, in dogs and cats, it would be removal of the tumor followed by radiation and/or chemotherapy.
Really?
Wow.
Yeah. Now, there's from some studies and research that I've done, and we talked about this earlier, about a drug or something that is recently that has come out to give to pets, just for pets.
There is a vaccination. It's a canine oral melanoma vaccine.
Wow.
So if the dog has the melanoma tumor in the mouth and is removed, then you can give the vaccination in an attempt to prevent it from reoccurring.
Wow, that's amazing.
Yeah.
And I mean, it's not approved for use in terms of like if you take a melanoma off another part of the animal, but if it's a malignant tumor, it might be worth trying the vaccine in an attempt to prevent it from spreading.
So they're still doing studies on that?
Yes.
Okay.
But it's nice to know that there's such advanced research that obviously, as we're pushing in humans and, trying to get a cure for that, but that there's such a concern for pets that there's, organizations and research facilities out there that are trying to help the pets. Like my concern is, here with Bullet, having such dark skin, dark fur, and Sandy having it light. Is there a difference? Like, would I be able to notice it in Sandy more than I would in Bullet if I was just looking them over?
It would definitely be easier to notice on this dog because she's light colored, but actually coat color and sun exposure is not associated with melanoma in dogs and cats.
Oh, wow.
The exception being white cats.
Okay.
If you have a white cat, then it's more prone to getting a sunburn if it goes outside, and then it can develop melanoma or squamous cell carcinoma.
Is there like sunblock for pets? Anybody out there?
There actually is a product called Peck Gel.
Oh, really?
That has a sunblock in it, and it also has an insect repellent. Wow. So if you do have a light colored animal, you could take it and apply it. You just apply a light coating. It's called Peck Gel. Okay. But the most important thing would be I would not let my gray or white cat outside. Okay. It's better to keep the cat inside anyway, so it doesn't get in danger from being hit by a car.
Yeah, it's good to know. Yeah, exactly.
Yeah. But it would be best to keep those pets inside.
Yeah.
Now, when you're doing the exams on the animals, I don't know if you could show us on Bullet, what are some of the things that you're doing and looking for, and is it something that people can do at home?
Sure, definitely. So when you're looking over your pet, you would see...
Because I'm always looking for ticks anyway.
Yeah. Right, exactly, good. You could see melanoma in multiple locations on the pet. In the dog, you can see it.
The cat is like,
you could see it if you parted the hair and you found like little lumps in the skin. Okay. You could see it anywhere over the trunk.
Would it be a lump? Because in some melanomas, it's not necessarily like raised to begin with. It could just be changing of color or something like that to try to get it early. But you would definitely be able to sort of.
Well, with pets, because they're so covered with hair, it's really hard to see like a change in the skin of a pigment change in the skin.
Yeah, that's what I'm saying.
Most people,
this dark too.
Right, exactly. Most people will come to the veterinarian and say, "Oh, my dog has a lump." So you'll part the hair and you find a lump. So any kind of suspicious lump on the pet should be looked at.
Now, in a routine visit, like, I'm a new pet mommy, so I'm learning all these things. When you bring it to the visit for their annual checkup or for a shot, would it be routine that as a veterinarian would look over the skin for possible lumps or possible melanomas? Okay.
Yeah,
I wasn't sure
definitely.
if that was part of the routine. Like, obviously, as humans, we would go to the
Right.
we would go to our medical doctor. They wouldn't look over our body. They would just give us a typical physical.
Sure.
We would have to go to a dermatologist to have them look at us for an
Right,
annual.
no, you're the general practitioner veterinarian, and that's why we want to get the owners to bring their pets in at least once a year.
Yeah, I was gonna
Even if
ask
they
that, so
don't
once a
need
year.
vaccinations, it's really important to bring them in yearly so that the veterinarian can look at the pet, and they would always do a full physical examination. And you could see the melanoma as a lump on the skin in the dog. Sometimes you'll see it on the edge of the ear or in the ear.
Is there a certain, my last question is there a certain prominent area where it would be found in a dog?
Yes.
Or, in a pet?
Yes, in the mouth is really, really common. You would look inside the mouth to see, and an owner might notice any kind of bleeding from the mouth, any kind of odor, any kind of lump in the mouth. It doesn't necessarily have to be black either. It could be pink or flesh colored or it could look like the gum, but it's in that mouth, and you would notice maybe an odor, blood, trouble chewing, and you could see the lump in the mouth if your pet will let you open the mouth.
Not so much on this one.
Right. The other really common area on the dog is the foot pads. You would notice, you might think it's an infected toenail or an infection on the foot, and it's actually a melanoma tumor. It will occur on the pads. Any kind of tumor or any kind of lump on the pad should be removed and biopsied. Also, anything from the mouth should be removed and biopsied.
See, this is all good stuff. Like,
Yeah,
I
this is
would,
great.
Obviously in the research we've done, and we spoke about on the show in the past about melanoma in pets, but nothing to this extent of thinking, because obviously if I saw something on my dog's paw or whatever, or bleed, I would just think, all right, well, let's give it a few days.
Yeah, they
maybe
got cut, they did
they
it
got
themselves
cut.
type thing,
Exactly. But this is very good to know.
The other place on the dog that it will occur, you can look, it'll often occur on their scrotum, and it will occur in their groin. So
Amongst the ladies.
Important to look in those areas.
sport.
Straight out.
Amongst all the girls.
Yeah. No, this is really good because I think that people, as with melanoma in humans, I don't think people know about this. They don't pay attention to it. It's not common knowledge.
And obviously having, pets, it's our babies.
Right.
It's
our fur babies.
It's so important to be in tune. And not that we don't take our dogs or our cats to the vet, but we basically, the shots, the, what is it for the ticks, or the heartworm, or things like that. A lot of people don't look this in depth to being cautious to what's that on their mouth, or what's that on their scrotum, or what's that, so this is all very important information.
Yes, thank you so much.
In the cat too, what you would look for, you would look at the pupil of the cat, because cats will get it in their eye, and you can actually see, it almost looks like the pupil is bleeding out black to the side.
Kind of like it was in humans on ocular melanomas.
Yes,
Yeah.
and you can also see it in the cat or the dog on the eye as like a raised kind of flesh-colored area on the pigmented portion of the eye.
And is this common for a cat to be in the eye?
Yes,
like a
very
common area. Okay.
Very common. Also in the cats, they'll get them on the eyelid. There'll be little black bumps around the eyelid. Or especially in white or gray cats, it's okay, come here, honey.
Lily's like, are you
Come
kidding
here,
me?
honey. Give her that other dog and you can hold her. She's getting cranky, but you would see it on the edges of the ear and on the eyelid, especially white or gray cats when I put her in.
And being that you have been a veterinarian for 22 years is quite impressive. So we have a very knowledgeable, educated veterinarian with us today, who's obviously seen so much in that time, frame. And what made you want to get into this field?
Well, I really loved and enjoyed the pets. That was the main reason, and I also liked science and math. But can I make a few more? I want to make a few more points about the melanoma because that's important to know.
Yes.
So, if you bring your dog or cat into the veterinarian, well, especially in the dog, for lumps on the skin, what your local veterinarian will want to do is to take that lump and take a needle biopsy of that lump.
Oh, okay. Not a lumpectomy or anything?
Well, initially,
Okay.
you would just take a needle biopsy of it. Sometimes in the cat, that's more difficult because, as you can see, the cat's squirmier.
Right. Yeah.
And it's difficult to do that. So for the cat, they might require sedation. But right in the office, the veterinarian could take an aspirate of that lump, put it on a slide, and tell you in short order if it may or may not be a melanoma.
Really, right there.
Then-
Man, see, I wish that technology. Why isn't that technology
for us?
Right. And then with the pet, if it does look like some type of malignant tumor, sometimes you can't tell exactly what it is from the fine needle aspirate, but you can determine is it malignant or not. Then your veterinarian would want to do a complete blood count and a biochemistry panel to check to make sure the dog can undergo anesthesia safely, dog or cat.
Right.
Checks their liver and kidney function, their clotting time, and these type of things. And then also it's important to do chest x-rays,
Yes.
radiographs of the chest, because melanoma will metastasize to the
Right.
chest. So we want to do those chest x-rays and then of course get the dog or cat in for surgery right away.
We actually had a little cancer scare with Sandy, so this is all exactly the steps that we took.
And
Yeah.
you know, how did
She was free and clear. It was
Okay.
just a benign tumor.
But you see, this is, you know, and I know a lot of, you know, pet parents out there would take these proper steps.
Right.
You know, they would, you know, go to the vet and they would get this checked and they would, you know, be on top of it. But a lot of times, like these very great points that you brought out, we wouldn't think of that.
Right.
We wouldn't think, oh, it's bleeding or it's this or it's pink.
Right.
We'd think, oh, it's
Right.
black. So these were all great points to
Yes.
to take care of. And we are
you
so
so much. We're
thankful
very
that you were on the
appreciative.
show and sharing with our viewers all of this very important information. You know, if any of our viewers at home have questions or would like to know more information about what Dr. Peck has informed us today, please, you know, go to, you know, skintalk.org and, you know, ask
Send
us,
us a
check out our
message.
site, or check her out at the Hampden Veterinarian Clinic.
Welcome back. We've got Leanne's segment.
Yes, so
Leanne,
excited.
what do you have for us today?
I see more alcohol.
God,
Another episode with booze. What is this?
It's your MO.
It's such good, goodness for the skin because they make it with, berries and fruit and
Yeah, that's a good
wheat
excuse.
and
Sure, and
so
you can drink it.
Yeah.
how much more natural can you get except for alcohol?
Let's not, say that too loud. So what are we
On
making
your
today?
skin, not in. Today we are going to make some travel wipes. So if if you're on the plane and it's kind of hot, or if you're kind of get sick when you travel, but a nice cool compress would feel good, you can actually take these with you, or keep them in the car. If you've got young kids, you can wipe your hands with them. You can wipe dirty faces with them. You can, if you're at the grocery store and you've got the shopping cart, you can wipe those down or wipe your hands after. So they're handy little things to have without having to spend, $5 on a little tiny travel pack that you're just paying for, the shipping and packaging and all
let
that
me
good stuff.
tell you, if it wasn't for the fact of me having children, I didn't know what a handy wipe was. And I swear by them, and they could be 50 and I'll still be carrying handy wipes because it's such a miracle thing.
But I'm really glad you're doing this because I always worry about what's in the handy wipes you buy.
Yeah.
So I'm interested to see what you're going to put in here that's more natural.
Exactly. That's
And
why we're
alcohol
doing
does
some do-it-yourself ones, because they have the other brands, the name brand wipes all over the place at the hospitals, at the stores, everywhere. And they could contain triclosan, which is an endocrine disruptor. So it can really harm your body with the buildup if you constantly expose yourself to it. Not to mention they're very drying on the hands.
Yes.
So if you make your own, not only do you save, quite a significant amount because you can see my huge bottle of vodka here. I can make a lot of handy wipes with this.
You can do other stuff with the vodka too.
Exactly. Little for, you, little for mommy.
So it's good too because of the fact that with the immune system, and that's the one thing that sort of does, if you have a healthy immune system, then you're able to fight off stuff. And those who are sick or going through certain things with melanoma or certain diseases, they have to keep their immune system strong. So something like this to always have handy, and you know how people walk around with the sanitizer, I don't even know what's in that.
Yeah, exactly.
Yeah.
So this is good.
You make a great point, Deb. People who already have compromised immune systems, you do want to keep yourself healthy. And actually, you don't want to wipe before you do something, you want to wipe after, like before you eat, after you've been touching things. If you're wiping your hands before you start touching things, you actually are compromising your immune system in a different way, but that's for another show. So I'm going to show you quickly how you can make these wipes. It's super easy. You get a roll of paper towel. The ones that are already perforated will do. If they're more expensive, get the ones and you can cut them, rip them. I've ripped these in half. And you can make them all kinds of different sizes too, which would be great if you have little jobs, big jobs to do. So what you're going to do is get a bowl. You can use a whisk or a spoon. You're going to get some vodka, some vegetable glycerin, which you can find at health stores, or you can get it online. You can get some lemon essential oil. Great thing about the essential oils, you can mix it with lavender, a little bit of tea tree. The lemon is antibacterial, antimicrobial. You can use lime. So you can have a lot of fun with this and mix them up. And if you do play with essential oils, you can see the different properties of them. Like lavender is well known for being antibacterial as well. So depending on the essential oils that you use will depend on, the higher the strength that you're using here.
So you could sort of create it to your own scent too. Because I know there's some friends of mine that they're so sensitive to certain smells that they have to literally go so far out of their way to get wipes that are like, organic, scent-free, and all this other dyes, because they're allergic to certain things. So on so many levels, this is great because it'll, it's really personalized to the person who does have certain, immunity issues or sensitivities to certain things.
And if you want unscented, you don't have to add the essential oils, although essential oils fragrance is very different from the fake fragrance that would be in a baby wipe or even laundry detergent, things like that. That fragrance is a bunch of fake synthetic chemicals making that up. So what you want to do, go over this quickly, you're going to use about a half a cup of vodka and you're going to pour that in to the bowl, and then you're going to take a half a cup of water and mix that in. You're going to take about a tablespoon of vegetable glycerin, and if you have a bottle like this, you can just use the cap, and that's like a tablespoon. This is how I bake at home. Don't ask me to cook, I can bake. And then you're going to use about 10 drops of lemon essential oil, so you can pour a little bit in the cap, and there you go. And then you just mix that up. And once it's all mixed up, then you're going to take your paper towels, and you can one at a time soak it in, and then you can just put it in your Ziploc bag afterwards. So you can do this whole thing and put it in the Ziploc bag, zip it up. You can even roll it to get the air out so that they don't dry out. And there you go, you're all set. You can toss it in your bag.
Easy. I know.
You can throw it,
And very inexpensive, depending on what type of alcohol you choose to use.
Don't use your V1 or your 3 olives, Go out and get the $14. Exactly.
Well, you are amazing, Leanne.
And Leanne, actually, our viewers think you're so amazing. We have a little quick question for you. One of our viewer emails this week was for you. They want to know if you recommend, when you're making these concoctions, using organic products. What are your thoughts on that?
Organic, you want to look for the certified organic label. It's kind of like you were talking about with the SPF marketing. Organic, if they just splash organic across the label, it's not necessarily organic. They have to do a lot for the certification label, although some ingredients are very difficult to find organic, and even then when they say it may not be. So you really have to do a lot of research for that, and that's why sometimes I won't even use organic because it's just, I know it's not true organic.
Okay.
But we do the best we can where we can, control what you can.
That's
Love
good
it.
to know.
Thank you so much, Leanne.
As Megan would always say, you're a rock star.
You're a rock star. And stay tuned, we have more show coming up for you.
Hi, I'm Renee Banks, the first runner-up to Miss Massachusetts Outstanding Teen, and hopefully the next Miss America's Outstanding Teen. I take a lot of pride in skin safety, not just because I am involved in the Miss America's Outstanding Teen organization, and healthy and beautiful skin means everything in a pageant, but because my grandfather passed away from melanoma. And my mission is melanoma awareness.
Hey, where's Renee?
I think she's doing a PSA on the set.
Oh, let's go check it out.
All right.
You must know my good friends from Skin Talk.
Hey, beautiful.
Hey, what are you up to?
I was just talking about you ladies because thanks to you, I am able to spread my own personal melanoma outreach.
And I know what that is. To educate.
And to demonstrate.
And terminate melanoma. So keep watching Skin Talk.
Thank you for the continued support from our sponsors. It's All About Me for dressing us every single show.
Yes, and also Wilbraham Flowers for providing us with some great flowers to decorate our set and help us look good. Welcome back. I tell you, Leanne was just fabulous as always.
I know, she's always got great tips.
She always rocks it.
And a viewer email for her too. That's something that we encourage. We love that. So
yes. Anything that you would like
questions.
to ask her, or tips that you're curious about, or
products you want to learn more about.
Yeah, exactly. Please, yes.
Right in. And can I just take a proud mommy moment and talk about my fur baby on TV?
Sandy was so good.
They were all so
and
good.
So cute.
Lily was getting a little agitated.
I know.
But I would be too if I were the only cat among all the dogs.
I know. Yeah.
She was like, put me back in the crate, please.
Yes.
Yeah, but
I know.
Dr. Peck had a lot of really good information.
Yes, she did. She was
Very informative.
I was really taken back by how much you really do need to look into with your, fur babies as far as melanoma is concerned. Like, obviously, we knew that pets could have it. That's why our interest to have her on the show. But I was really taken back as to how many points. And I just want to stress again that if you would like to know more detailed information about what Dr. Peck was talking about, if you weren't able to grasp it all in her interview with us, then you can go to skintalk.org, as we're going to list all the details of what to watch for and what to look for, and the drugs and the steps if you do find melanoma and stuff like that.
Yeah, and I think it's really important for people to hear this, because it's just like melanoma in humans. We just don't know this knowledge. And it's funny because I'm going to go home and ask my vet, do you do this check when you see our animals and my
I am
animals?
too.
Because I don't know.
Yeah.
I don't know if they're doing it.
Yeah.
So,
and again, like when she brought out those points that it wouldn't be black, which we were typical of seeing something black on the skin. It could be flesh color. It could be pink. So yeah, definitely.
Good guess.
Yes. So speaking of good guests, to our viewers out there, we would love to know what type of guests that you would like to see on the show.
Yes.
What type of, profession
Topics.
or what type of topics that would be of interest to you. So please Facebook us, email us, tweet us. Let us know, because we are here to please.
Yes, and if you think that you would make a good guest, make sure that you write in as well, because you can, it doesn't have to be someone else you're nominating. You can nominate yourself.
Yeah, exactly. We want to educate, but we need your help and info to
input.
Direct us and make sure we're getting you the right information and keep the show, rocking, as you would say, rock star.
Yes, absolutely. And thank you so much for watching, and make sure you stay tuned.